Maurice Engleman is 82 years old. He was diagnosed with tongue cancer a week after he lost his beloved wife of 59 years. He fought cancer and beat it. Now he wants members of Congress to know he's fighting to keep the health care that saved his life. Engleman came to Washington, D.C. with 70-year-old Patricia Long, also a cancer survivor. They are both members of Desert Oasis Healthcare in Palm Springs, California.
Desert Oasis literally saved my life.
Also along was Dr. Marc Hoffing, Medical Director of Desert Oasis Healthcare, and LaDonna Headley, Director of Case Management. The group spent the day walking the halls of Congress, going from the House to the Senate and back, meeting with key legislators, reinforcing the critical difference that Medicare Advantage and Desert Oasis has made in their lives.
I can truthfully say, if it wasn't for them, I would not be here today. If it wasn't for my caseworker being there with me, and when I'd come home from the hospital, there'd be a nurse and a doctor checking my blood pressure, checking my medication.
Desert Oasis Healthcare is part of the Heritage Companies, led by CEO Dr. Richard Merkin, that manage and coordinate accountable, patient, doctor-centric, cost-effective healthcare that is a successful working model that is duplicated in 25 other facilities in California and one in New York. The goal is to keep patients healthy, happy, and out of the hospital. In cancer diagnosis, like Maurice and Patricia, the care is even more intense.
All of the most complicated, ill patients in the system get assigned an intense case manager who works with them through their illness, even from sometimes before it's diagnosed. Even if they have a lung mass, we assign a nurse. That person will go with them to their appointments. They'll help sort out the medical information, coordinate issues with their family, any social needs. They'll bring in a social worker. Problems with their medicines, we'll bring in a pharmacist. So all of these things that we're able to do under Medicare Advantage that we would never be able to provide under traditional Medicare.
Maurice and Patricia are members of Medicare Advantage, one of a number of options offered by traditional Medicare and is implemented by Desert Oasis Healthcare. Both of them agree the care saved their lives and brought 10,000 signed petitions from other Medicare Advantage seniors enrolled with Desert Oasis who feel just the same way, reinforcing to legislators, don't cut this critically important program.
Well, thank you.
Currently, there are 10 million seniors enrolled in Medicare Advantage in the U.S. And according to the latest statistics, their savings are close to $1,000 per year. So the care that Desert Oasis implements through Medicare Advantage saves lives and taxpayer dollars. Just ask Maurice and Patricia. They felt so strongly about it, they came to Washington to show the country this really is democracy in action.